Root cause analysis. The root cause analysis is a systematic approach used to identify the fundamental cause of a problem, which aims to prevent recurrence by addressing the underlying issues rather than its symptoms. The case study identified by Baby M was initially stable upon delivery. However, developed signs of respiratory distress shortly after being bathed. This required medical support and further investigation to determine the cause, which can be attributed to a few problems. Delivery related factors. Number one, thick meconium presence. Increased risk of aspiration syndrome, though no meconium was evident in suction material. Number two, thermal distress. Bathing 2 hours post delivery could have caused hypothermia and subsequent respiratory decompensation. Number three, stressful transition. Environmental or delivery related stress may have delayed the clearance of lung fluid, contributing to transient tachypnea of the newborn, or TTN. Neonatal factors. Number one, hypothermia. Early bath reduced core temperature to 35.8 degrees Celsius, leading to peripheral vasoconstriction, metabolic acidosis, and increased oxygen demand. Number two, immature lung function. Despite being term, baby M may have delayed surfactant production or fluid retention as seen in mild respiratory distress syndrome, or TTM. Number three, hypoglycemia. Increased metabolic demand due to cold stress, although blood glucose levels were within normal range. Lastly, environmental factors. Number one, inappropriate timing of bath. Bathing a newborn within 2 hours of birth is against standard guidelines as it impairs thermal regulation. Number two, delayed oxygen supplementation. Initial hypoxia may have exacerbated respiratory distress. The root cause of baby M's respiratory distress appears to be cold stress induced by an early post-delivery bath. The early bath led to hypothermia, which compromised oxygen delivery and metabolic processes, exacerbating underlying conditions such as transient tachypnea of the newborn (TTN) or mild respiratory distress